Now I'm prepared to treat the patient and bandage the wound. And for this purpose, I'd like to demonstrate once again. I have just donned a sterile gown and I have sterile gloves. I want to be sure to keep the wrapper of the sterile gloves off my sterile field. It doesn't matter what it is, that nothing can contaminate my sterile field. I'm opening my gloves. And again, I can don those carefully. And with practice, this gets easier. There. And now someone else has unwrapped the patient's wound. And now I can reach in and touch anything that's on the sterile field. I can touch the medication. If it's wiggling around, you might want to get someone else to hold that for you because you cannot touch it with your bare hand. Then I can apply some of the medication. Careful not to touch anything else. So applying the medication to their wound, this is now contaminated. I cannot put this on my sterile field. I could put it here, but I need to drop it and clear my hands. I could also put it in another location, such as that wrapper for my sterile gloves. Right now I'm just going to lay it here, but I don't want to touch the wound itself. Got my 4x4s that I'm going to cover the wound. And then my sterile gauze, which all these items are sterile. And with the patient's assistance, they can lift and I can begin to wrap. And once I've touched the patient, my hands are contaminated. But as long as the wound is covered, it's not an issue any longer. We want to be careful that we're not putting pressure onto the patient's wound because that's the whole point of being here. They're in pain and we don't want to contaminate or cause any infection. And you want to cover that top, that 4x4 completely and use the entire roll of gauze. Certainly the patient can, hopefully on an extremity, can hold their limb up for you, or you might need to get an assistant, someone else, to hold their limb in place. So we've got just about the whole roll going on here. And then the patient is covered. Now I can doff my gloves, and I would want to bring my hands up and pull the gown down. I actually need to untie first. Pull this down, keeping the gloves buried inside so that they don't see the light of day again. Putting these in, and we're going to assume that those are contaminated, wrap that all inside of itself, and this could definitely go in the biohazard bag. At this point, I would use my tape that I had torn off earlier and secure the wrapping on the patient's bandage, taping gauze to gauze, never putting tape all the way around in a transverse to the limb, and never putting tape to the skin, unless occasionally you'll have a bandage that will just have to be held in place in that way. With paper tape, I could write on this the date that it was bandaged. Then I can tell this patient, great, now go check with the receptionist and make another appointment. At this time, hand washing, about a 1-minute hand wash would be a good idea. And then I can start to clean up and secure my area. Again, the medication is used only for this patient, and it would have their name on it from the pharmacy. And I would never ever use this on another patient. If this patient is discharged and I know they're leaving, I can give it to the patient and they can take it home with them. It belongs to them. But we would never ever use this on another patient. So I could don non-sterile gloves and clean up the mess, because this is probably going to be quite wet if my patient is gone. I don't want to handle the water, the wet that the patient's limb has been involved with. So non-sterile gloves to protect me. Then I can carefully wrap the contaminated items, put them into red bag trash. The other items would go in the trash as well, but these were not contaminated, not touched by the patient, so they would go in the regular trash. And this would go in a safe place to be used again.